maybe we're not asking those questions around their pain comes on when they're on their period, and you realize actually that kind of hip pain might be more related to the endometriosis you didn't even ask that patient about.
How would you ask that in clinic in a way that the listener can then go, immediately take that and go, I need to ask that better? How would you ask it in clinic?
I think it's how you land it. And so I'll usually start it with, I'm going to ask you some questions now around your cycle. And it's not to be intrusive. I just need to know, because sometimes your cycle really matters when it comes to injuries. And so it might give us a little bit more of an understanding about what's driving your pain. And so that's when maybe I would lead in with like menopause questions or missed periods for things like relative energy deficiency, or if they've had any other issues like endometriosis and past medical history. Because I think maybe women, if you do ask past medical history, they kind of sit down in front of you and you think, okay, so have you had any other, heart problems, lung problems, or any other injuries? We might be used to asking those questions, but don't necessarily think that patients will always give you like, oh yeah, I have endometriosis actually, and I'm having some investigation for that. Unless you ask the question, sometimes it's left unsaid. So I would always encourage people to do that. And I pick it up with things like dysplasia as well, asking the questions around, did you have any childhood hip pain, and did you have to wear calipers, or were you ever in supports? And often they're like, no one's ever asked me that question before. That's really interesting. And it's the first time then you can pick up something else that maybe you don't need to manage, maybe you need to refer on. But if you can be that person, then I feel like you've done a good job.